Anthony Stevens. I'm a neurologist, and I'm in a solo private practice, loosely affiliated with 4 other neurologists. I am at the bottom of the evolutionary ladder for technology. I mean, when I say I'm low tech, let's put it this way. I don't have a computer at home. I've never played a video game. And the only time I turn my cell phone on is to make calls.
Okay.
So I'm very low tech, all right? And in fact, I was very resistant to the whole idea of electronic medical record from the start. I have found it that empowers, it's easy to use. A lot of the stuff, like some of the stuff I've noticed is handy is that if they have other tests from other doctors, I automatically get that information to me when I look at their record on the computer in the office. So that's excellent. And any other doctors who are on the system, I also can access their office records. So huge difference in let's say man hours of collecting reports, and in fact it's difficult sometimes for like the people in my office to understand what it is I'm looking for. They can't just a priori understand that I'm going to want this lab report and that X-ray or that MRI or something. And in the old days, just having fax copies of all these reports, and in many cases, especially with imaging, I want to look at it myself. I can do that now on the Empower system very, very easily, and I'm free to just pick and choose the information I need to gather without having to go through someone else and explain to them what it is I need. So again, the following up on patients who have had any type of workup in the hospital as an outpatient-oriented patient is very easily accessible for me, and that's made a huge difference. So I'm excited about that. Also, when I see a patient in the office that may have been sent to me by another doctor as a consult, it has an advantage, another time-saving thing for me. Instead of me seeing the patient, doing a workup, dictating a letter, having someone transcribe the dictation, reading the dictation, correcting the dictation, signing it, and sending it to the doctor who referred the patient, I can automatically fax my note directly and whatever information I want to transmit to the referring doctor as soon as I see the patient, or as soon as I get the results that I'm looking for back. So that's literally push of a button instead of a lot of extra work. I think the Empower, just from my point of view, is easier to use. It's got to be user friendly for me because, as I said, I have no experience, really tech experience at all. Oh, it was obviously designed by doctors. Let's put it that way, because it's I don't know how to explain this. It's really hard to explain how I could just tell a doctor was involved with it, because it's like the way we think. It operates the way we think, and it speeds things up. The kind of usual and customary stuff that we do all the time speeds things up there. A lot of it, the type of language that's used and stuff is this type of language doctors would choose to describe their activities and so forth, or their findings. But it's hard to even explain. It's almost like an accent or something that it has that is pretty obviously doctor friendly and doctor produced. I'm really happy with it, and as I said, it seems to be real doctor driven, which is really important. That the way that doctors approach patients in medicine and retrieving information, what information they want to transmit. It's set up in our language. Let's put it that way. I mean, I don't know if you ever saw that commercial. Mikey likes it, but I don't like technology, and I like it. So I keep joking about that it's a Mikey likes it thing because, as I said, I'm very low tech, and I'd say I was almost even opposed to just changing things because it's just something else to learn. But this was so easy to pick up, and the time-saving stuff and the communication in between doctors and so forth and hospital stuff is so quick and effective that I can't disagree with it. So in other words, to try to answer your question, I think that more people like me who aren't so keen on all this would be surprised if they tried it and started seeing on a regular basis how much time they're saving and how easy it is. It's really not just how much time they're saving, but how easy it is to access the information or transmit the information that's important to me.